So my name is Nancy Hammond with Integrate 360 Physical Therapy, and this is part 2 with Smart Group Training. So today I'm going to do some hands-on showing you a few assessments, and then we're going to go through some techniques just to try and reposition pelvis and rib cage. I'm going to use you, Clint. So the first test I'm going to show is the Hruska adductor drop test. So I'm not really going to show you how to do it, I just want to demonstrate. So go ahead and scoot back towards me. So I just want him in a good neutral position. I'm going to bring him back. So I can get him back to neutral between flexion and extension. And then when I go to drop his leg down, that's all he has. So what I would want to happen is that his knee would go down to the table. But if I keep him in neutral, that's all he's got. So go ahead and turn on your other side. Just actually put your head at this end so that we can see. I'm going to check his left side. So I know that Clint is a PEC because his right leg didn't drop. So remember, if his right leg doesn't drop, his left leg's not going to drop because he's a left AIC, and under every PEC is a left AIC. So same thing here. So he's in neutral, knee won't go down to the table. Go ahead and turn on your back. So I'm going to check his internal rotation. Go ahead and bend your knees for me. Just going to stabilize his rib cage. And that's what he has as far as internal rotation. So his hand should touch the table. So this tells me about position of the rib cage, what the diaphragm's doing. I'll check this side. So I don't know if you guys can see, flip around so they can see your left arm. And slide to your right. So this is what should happen on that right side. Is that it should go down. And remember, because we tend to have more rib flares on the left side, I'm sure you guys see that. If we lifted up his shirt, you can probably tell that his left rib cage is more flared than his right. So because that left rib cage is flared, that right scapula doesn't have a good place to sit against his thorax, which is causing that limitation in that internal rotation. Okay? All right, so let's have you stand up for me. I'm going to come over here, and we're going to do the short-seated stair balloon. So I'm going to have you sit here. So this is an activity that I have a lot of the clients doing. You guys have seen your clients do this, hopefully, to reposition before and after they do their workouts. So just sitting there, part of postural restoration is really being able to find reference centers that will help reposition your patients or your clients. So just sitting there, can you feel your sit bones, the bones you're sitting on? Okay, which one do you feel more?
The right one.
Okay, so I want you to try and get on that left one. Just so that they have an awareness of that left sit bone. I want them to feel both, but really to feel that left one. Because remember, under every PEC is a left AIC. Then you hold the balloon in your right hand. You're going to drop this arm. Okay, so I'm just going to talk you through it. But when you breathe, you're going to breathe in through your nose. You're going to blow out into the balloon. After you exhale into the balloon, you're going to put your tongue on the roof of your mouth. You're going to pause for about 4 to 5 seconds. That's what's allowing your diaphragm to dome and your system to reset. Okay? After you've paused for 4 to 5 seconds, you're going to breathe in through your nose again, blow out into the balloon. Do you have gum?
No.
Okay. So let's drop your rib cage here. You can still feel your left sit bone?
Mm-hmm.
Okay. I want you to take a breath of air in through your nose and blow out into the balloon. Nice, easy exhale into the balloon. Good. Put your tongue on the roof of your mouth. Take a breath of air in through your nose. Blow out. I can feel his rib cage come down as he exhales. Pause. 1, 2, 3, 4, 5. I want you to take a nice, easy breath. Try and feel some air here into your upper back. Blow. Good. Pause. Still got that left sit bone. Good. I want you to try and keep these ribs down. Try and relax your traps. Take a nice, easy breath of air in. Better. And blow. Good. Tongue's on the roof of your mouth. Pause. 1, 2, 3, 4. Take a breath of air in, and take the balloon out. So I don't know if you guys could tell, but he was using some of his neck as he was inhaling. I want him to really try and keep those ribs down, so he's getting some posterior mediastinum expansion and really using his diaphragm to do it. And blow. Good, and pause. 1, 2, 3, 4. Take a nice easy breath, try not to let yourself extend. That's better, and blow. It's just a nice easy inhale, you don't have to try and get all the air in. Nice easy inhale, that's much better, and blow. Feel that left sit bone, feel that left heel on the floor. Just gentle. Take a breath of air in, and blow. And pause. 1, 2, 3, 4. Take a breath of air in. Nice job. And let the balloon out. Okay.
Better.
Yeah. Yeah. Can you guys see the difference? What? Okay, so let's put your head at the other end now. So that's a negative Hruska adductor drop test. So we now know that his right hip and pelvis are in a neutral position. Oh yeah. Let it go. Came back so much easier. I thought it was going to plop right down, but. So he's almost there. So I would just want to do a little work with his left hamstring to get that left hip all the way repositioned. So let's do the 90-90, because then we can get your hamstring a little bit more. So I'm really picky about this activity and how people start doing it. A lot of people will just raise their hips up, try and get their hamstrings on. But the first thing I always have my clients do is take a breath of air in through your nose. And then you're going to exhale, feel those ribs come down. As you do that, I want you to raise your tailbone up just slightly. Good, so your knees go up towards the ceiling. As you do that, I want you to dig your heels down towards the floor to engage your hamstrings. Good. I really want you to be aware of this left hamstring, Clint. Good. And your back's going to stay flat. Okay? We should try and have a jelly belly here so that we don't have our rectus on. You can get your IOs and TAs, but not your rectus. Okay, so you're going to maintain this position as we do the balloon. Okay, so you're going to take a breath of air in. You can see his right apical expansion, and exhale. Just going to guide his ribs down. Good. And pause. 1, 2, 3, 4. Be aware of this left hamstring. Breathe in. Blow. And pause. 1, 2, 3, 4. Take a breath of air in. Keep digging this left heel down towards the floor. Good. Blow. You can see his ribs come down as he exhales. Pause. 1, 2, 3, 4. Breathe in through your nose. And blow. Nice job. Pause. 1, 2, 3, 4. Take a breath of air in. And let the balloon out. Nice job. Could you feel your left hamstring? Could you feel your left inner thigh at all?
Maybe a little bit.
Okay, let's go back. Internal rotation. But now his left leg drops. Just making him aware of that and helping him find that left hamstring. He repositioned his left pelvis. Put on your back. So there's several objective tests that I do. These are just a couple. You can see now his right arm fully rotates. So by getting those left ribs down, his right arm has full internal rotation. Can you feel the difference?
Yeah.
Okay. Do you guys want to try those activities? I guess you can do it again if you want. Whitney, you doing it? Alicia? What? Sure, I'll coach you. Does everybody have a balloon?
You ever want a ball between the legs on this one?
You can.
Does it matter?
You know, if people
Where is feet position? Like, where do you want your feet?
like that. So if people tend, you know, some people who are really extended will come sit here, and they're like this. So I'll just put a ball just to help keep them, give them a little adduction. Sometimes I'll have them squeeze a ball with just their left knee so they can find that left inner thigh just to help reposition their pelvis. Okay, so. Oh. Okay, so you're gonna put your feet flat on the ground. Good. Can you guys feel your sit bones, the bones you're sitting on? Okay, which one do you feel more, left or right? Good. Jenna? Okay, I just want you to have an awareness of that left one. Alicia? Good. Okay, Christy, you got your left? Good. Okay, we're gonna drop your ribs. Good. Both sides. Good. Still got those sit bones even as you drop your ribs? Yep. You drop your ribs. Good. Flex, 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 flex. Good. Probably feels weird to you, huh? Okay, so we're going to take a breath. Go ahead and drop your right arm to your left arm to your side. I'm sorry. Going to hold the balloon in your right hand. You're going to take a breath of air in through your nose and blow out into the balloon. Good. You're going to, after you exhale into the balloon, I want you to pause. 1, 2, 3, 4. Take a breath of air in. Try and fill some air in your upper back and blow. Still got your sit bone? Good, you can pick your head up. Good, breathe in and blow. Try not to exhale using your neck. Use your abs and your diaphragm. Pause. Breathe in and blow. Let's pause. After that exhale, 1, 2, 3, 4. So after you breathe in, take the balloon out of your mouth. Can you tell how you kind of lost? Do you have to pinch the balloon? Yeah. Okay. We need to work on that. Go ahead and let the air out. What do you guys think? Questions?
This arm should just be hanging.
Yep, and the purpose of having this left arm hang is just to get those help get those left ribs down. Sometimes I'll have people put their left elbow on their knee, come forward just a little bit. You're not really reaching towards the floor, you can, but it's just to let that hang. Mm-hmm. Yeah. Okay, let's do it again. Anybody have any questions before we do it again? Is it okay if I pinch it? You can pinch it. Probably what I would do for you is either use a less resistance balloon, which are the clear ones. You can also use a straw. Even though it's not going to inflate, it's still the resistance of the straw that would work for you. Is it hard for you to?
It's really hard.
Okay. So another trick we sometimes do is cut a hole in the end of that balloon. Just so again, it's not going to inflate, but it's going to give you a little bit of resistance. And then after doing that a couple times, you'll be able to blow that one up. I should have brought over some of my easy.
These are really hard for me.
So I want you
I might be dying or something.
there, because can you tell you keep your ribs. I want you to keep your ribs stacked on top of your pelvis. Pick your head up. So as you exhale, you're doing this. So you're exhaling with your mouth, not your ribs. I mean, not your abdominals and your diaphragm.
Okay, so just kind of keep my head up here.
Yep.
And then lean forward.
Mm-hmm. Yep. Just keep your ribs stacked.
Like that.
Yep. Can you feel your sit bones still?
Yep.
Okay.
Yep. Much better.
And you may even want to put your. Make it harder.
Yeah.
Yeah. See if we can do this.
Yeah, what am I supposed to, how am I supposed to be stopping it?
With the
Like,
tongue on the
as
roof
I-
of your mouth.
Okay. Am I
So,
supposed to
I'm
get
gonna help you.
more in my mouth?
No, I'm going to help you just a little bit. So you got your sit bones. You can feel your left heel and your right arch on the floor. Okay. So I want you to take a nice, easy breath of air in through your nose, blow out through your mouth. Not just yet. Sorry. So when you inhale through your mouth. I want you to
Okay.
inhale through your nose. Blow out into the balloon. Good. Put your tongue on the roof of your mouth. Don't breathe. 1, 2, 3, 4. Take a nice, easy breath through your nose.
See, that's...
That's how weak your diaphragm is.
I'm sure, yeah.
Hey, do you guys have a scissors?
I knew I was going to have breathing issues with a few years
Jenna, hold on. Take that balloon out before it pops in your face. No, we'll cut a hole in the bottom of it.
See, a few years back, I knew I probably should have done breathing. Like,
What did you have?
I had a collapse. Like, I had like a liter or two of fluid on one of my lungs, so I probably never got back to fully breathing.
With your, yeah, thanks.
That's what's up with your neck.
Probably.
That's why your neck always hurts, because you're breathing with your neck. Do you have neck pain?
Yes.
Oh, you got a straw. Let's just cut a little hole in there. So just do this a couple times with the hole in it, and then we'll get a new balloon and see if.
Right, this brain is like much harder than the regular one.
So it's not going to inflate. So go ahead and
Okay.
breathe in through your nose. It helps your diaphragm dome and your system reset, a neurological reset. Because when you're put you back into that extension pattern, so that pause, let your diaphragm come up into a domed position so you can use it to help you breathe instead of as a postural muscle. Good. Put your tongue on the roof of your mouth. Don't breathe. And blow. Just a little bit more with your left knee than with your right. Your right adductor likes to be on. Pause, don't breathe. And blow. Good. Put your tongue on the roof of your mouth. You okay if I put my hands on you? Take a breath of air in. And blow. Breathe in. Good. Take the balloon out. The other thing I'd say is I'm going to help you in 1 sec. You're really breathing with your neck.
Okay.
Try and keep your head straight.
Okay.
Because as you inhale,
So I'm
you
still
bring
here,
your.
but my head's still, okay.
Yeah.
I
Just
think
so
I
you're
was
more.
trying to over.
Right.
Yeah. So
Well, because you're
so-
trying to exhale using your neck, which is probably
Okay.
what you like to do in life.
Probably.
So if you can just keep like your eyes on more of the horizon, not necessarily looking up, because I don't want to extend your system, but just looking more at the horizon.
Okay. But then I'm still here, but then I'm looking.
Yeah,
Okay.
so do it one more time like
Okay.
we just did, and then we'll get a different balloon and see if you can do it with a regular balloon.
Okay.
Make sure you keep your tongue on the roof of your mouth and you pause after you exhale. Do you want to go try it, Christy? And then we'll get a... Clint, will you grab a couple other balloons over there, please? Okay, so you got your sip bones? Okay, can you feel your left heel and your right arch? Okay, so take a breath of air in. You okay if I put my hands on your ribs? Okay, so take a breath of air in through your nose. Blow out into the balloon. Blow, 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 blow. Good, pause. Tongue's on the roof of your mouth. Don't breathe. Take a breath of air in through your nose. Nice, easy breath. And blow. Feel those ribs come down. Good. Pause. 1, 2, 3, 4. Take a breath of air in. And blow. Feel those ribs come down. Breathe in. And take the balloon out.
Come on, breathe.
So, do that again. I'm going to see if she can do it any... Oh, thanks. She can do it any better now. And then we'll try with you and see if you can do it
Okay.
with the balloon. You done? Okay.
All right.
Find those sip bones. Good. Good. You're sweating, huh? It's hard work.
It really is.
Okay, take a breath of air in through your nose and blow. Good. Tongue's on the roof of your mouth. Don't breathe. Don't breathe. Breathe in through your nose. And look at you. Blow, 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 blow. Pause. Don't breathe. 1, 2, 3. Take a breath of air in. And blow. Blow, 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 blow. Good. Pause. 1, 2. Keep that tongue on the roof of your mouth. Keep it up there. Try and relax your cheeks. Take a breath of air in. Nice, easy breath through your nose. And blow. Blow, 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 blow. Pause. 1, 2. Don't pinch it.
I lost on that last one. I at
You
least
got the
one
first
breath
couple.
in, I know.
Yeah, so that was better.
It's something, yeah.
So I would have you, where I would start with you.
Start
is-
with that?
mhm.
Okay.
Just do a couple reps of this and then see if you can do
And try
1 or 2
this?
with that. Build
Okay.
up to where you can do 4 or 5 breaths.
Awesome.
So the 90-90 we're going to do next is going
Okay.
to be too hard for you.
Okay.
Because in this position,
This is
you
not
have
hard, yeah.
help getting your ribs down. That's going to be much harder for
Okay.
you. So I'm going to have you take a nice, easy breath of air in through your nose. Take the balloon out of your mouth for just a sec. Yep. Okay. So you're going to take a nice, easy breath of air in through your nose. As you exhale, feel those ribs come down. Do a little bit of a posterior pelvic tilt so your tailbone's up off the floor. Dig your heels down towards the floor to engage your hamstrings. So that's enough. Alexa, lower your pelvis just a little bit. There you go. Good. And feel your hamstrings engage. I really want you to be aware of that left hamstring. That left hamstring. Good. Okay. So you're going to maintain that position as you blow up the balloon. So take a breath of air in through your nose. Blow out into the balloon. Just put it up overhead, just to try and get some air into that right upper chest wall. So breathe in and blow. Good. After you exhale again, tongue goes on the roof of your mouth. Pause. 1, 2, 3, 4. Take a nice easy breath of air in through your nose and blow. Pause. 1, 2, 3, 4. Breathe in. Keep that left hamstring on and blow. Pause. 1, 2, 3, 4. Breathe in. And take the balloon out of your mouth. How'd you do over here? I know you do it pretty good, don't you? You can do it pretty good.
It's okay. This one I haven't had a ton of practice on.
Oh,
The seated one, I didn't have to do that one time.
right.
I kept taking the balloon out of my mouth, trying to keep it in my mouth.
Mm-hmm. Did you feel like you had to take it out?
I think I just held it weird.
Oh,
Just holding it weird.
yep. So you want to breathe in, blow out into the balloon. Pause. Keep it in your mouth. Tongue's on the roof of your mouth. Breathe in through your nose, blow out into the balloon. So yeah, the balloon never comes out of your mouth.
Okay.
Did a decent job on the left side.
Left hamstring?
Please.
Good.
For me.
I'll come check you if you want me to. Breathe in, blow out. Feel those left ribs come down. Good. Pause. 1, 2, 3, 4. Breathe in and blow. Feel those ribs come down. Good. Keep that left hamstring on. Really dig down towards the floor with that left hamstring or that left heel. Breathe in and blow. Jelly belly here. You're using a lot of your rectus.
That was my one struggle.
Breathe in and take the balloon out. I'll show them the standing resisted wall reach.
What's that?
Standing resisted wall reach.
Oh, I don't think we have time for it.
Oh, okay.
Just 'cause we only got like 3 minutes left.
Oh.
Clients start rolling in.
Got it.
I
Okay.
felt like my glute more than I felt
Yeah,
my
you were
hamstring.
using everything but your diaphragm, abdominals. You were using a lot of your rectus.
Yeah, practice.
Okay.
So, and we could talk more about it too. But so today we went over the stair short-seated balloon and the 90-90 hip lift with balloon, just to help reposition a pelvis in a rib cage. You can use that for a left AIC or a PEC patient. After you do that, you should have negative Hareska adductor drop tests on both sides and full internal rotation in both shoulders. Thank you.